how do you screen properly for the people that actually are passionate about rural healthcare? I imagine anybody's willing to say whatever it's going to take to get through their medical school interviews. Like, how do you actually sort the two out?
Yeah, no, very difficult, and you and I both know, right? You try to come up with the perfect system, and the very next iteration, students have gamed it so hard that they know exactly what to say and exactly what to
The
tell
cat
you.
and
So,
mouse game continues.
so it,
Yeah.
yeah, so it's always going to be a difficult challenge, but there has to be some belief in the person sitting across from you. So I know like the MMI, like you can't divert from the questions that are on your sheet when you're going through these interviews. You're not allowed to smile at them. You can't nod, right? You can't give any sense of where things are going and all that. We made that so impersonable because of the threat of students suing programs as to why they didn't get in med school. That's one of the major reasons that it's that way. It's not because we have data to back it up that this is more legit, it's better, it's less bias, and etc. But shouldn't we have a bit of bias? Shouldn't we actually have a different sort of process, whether it's random or not, to actually talk to the person, get the data out of them in a meaningful way? We can hire lawyers to do that, put them on the stand. I don't know, but like a meaningful way to get the actual truth out of them, as opposed to the rubric that we're trying to get and just kind of populate into them. I mean, you probably heard
They need a
Queens.
polygraph station as part of your
Yeah.
MMI, I guess.
So some schools have gone down. I mean, the scientific way of thinking about that one is some schools have gone down this emotional intelligence quotient kind of deal where they come up with different screening processes. A lot of that is done in the U.S. A lot of different screening processes to try to figure out how to tease out this kind of good human being aspect and who we want to be in a physician. Queens just announced in the last while that they've updated their application process to actually include a randomness into it. So I think at the very beginning, you have to meet certain criteria to get your application into the Queen's Medical School. Pretty sure it's Queen's. And then there's a random, literally, what it sounds like if you wrote everybody's name on a piece of paper, put it in a big hat, and then you pull out 600 people out of there. So, and then the 600 have to go through the kind of a more formal traditional screening process. But there's that randomness into there. I'll be very interested to see what that does, because we all know, like the U of C, U of A, Queens, there's almost 3,000 applicants to medicine in every school. Like we're not shy on people that want to do the work and want to do the job. What we're shy on is actually selecting the correct ones so that we don't need so many people. So we have the people that want to work and want to do the things that society needs.
Definitely, definitely. I mean, on the other side of things, I'm just like, what they tried looking at like mandating billing codes a few years ago and just like geographically restricting them. That didn't seem to be like a super popular idea. I don't know. Do you think there's any role for that, or is that just like we don't want to be prescriptive and forcing people down pathways they don't want to go? And then ideally, we should just have that upfront selection interview be a little bit more real and personable.
I prefer the upfront. It goes back to that comment about can we teach people to be good people? Can we teach people to be nice? Can we teach people to communicate? Or we're spending so much time on that aspect because we picked the wrong people to begin with, right? So I'm much more a fan of that part. It is much more challenging though, because that's like a whole bunch of light switches that you have to manipulate and change to do that, versus something like the billing code thing where you can say, you know what, our community or this part of Alberta, wherever, needs these types of doctors. And if you want to come be that type of doctor, you have to go there. So that's a much easier thing to do. But I prefer the other way that's more sustainable. It's more sustainable to look at the initial process, get the right people into there, and then we never have to talk about forcing people to work in certain areas. Now, that aspect of, well, society spent 300 grand to get you trained as a physician, and that is all lost, right? The notion that medical students understand that or care about that is lost. So it's really hard to use that as the argument, even though it's the truth, right? It is the truth. But the flip side is society chose to do it that way. So now you're going to force me to do these things. Like there's always going to be that disconnect, versus if we just go back to the very start and say, if we can change the variable from, you know 25% of medical students, usually the stat out there is that a quarter of medical students should never be doctors. The programs know this, the schools know this. They just don't
Based
know how
on like they're just
they just don't know how
not
to tease
doing
that out.
well.
It's based on like professionalism stats that a lot of
Yeah.
schools, a lot of places will have that, and then there's a lot of anecdotal evidence into there as well. So it actually could be higher. I'm just going to use 25%, but rather than focusing on the 25%, trying to make them into good, reasonable, hardworking physicians, why not just go back and say, can we make that 1%? How about we make it so that the other 24 are actually the reason we spend a lot of time and focus and get things going. Like, I think we should work that.
This episode is sponsored by Empathia.ai. This AI charting assistant captures your patient encounter and creates a clinical note, saving doctors on average 2 hours per day in charting. Healthcare professionals are often bogged down by endless paperwork. Their goal is for physicians to spend less time charting. Find them at www.empathia.ai. That's EMPATHIA.ai. I'm Dr. Jordan Valrath, and you've been watching Cherry Live, brought to you by Cherry Health. Please like and subscribe to see more clips like this, or check us out at www.cherry.health, Canada's medical network.